Everyone at Ontario Shores has been rising up to ensure the delivery of quality mental health care throughout the COVID-19 pandemic. Through Rising Up Conversations, we are proud to shine a light on individuals, teams, and disciplines who continue to go above and beyond to care for our patients and each other during these challenging times.
Welcome to Rising Up Conversations. My name is Darryl Mathers, and I'm with the Communications Department here at Ontario Shores. As we film today, please note, anybody watching or listening, that we are physically distant. We're in the same room, but we're using masks, and we are separated by actually more than 6 feet, and we're taking precautions and being safe, while also trying to highlight some of the great things that our hospital and the people at our hospital have done over the last year during the COVID-19 pandemic. And that's why I have my two guests here today. We have Desiree Cooledge and Shawn Senecal, both nurses in different areas of the hospital, but we're here to talk about something that you did together during the pandemic, and that's working on the COVID-19 unit. So first of all, welcome. And maybe Shawn, if you can start by explaining what is the COVID unit at Ontario Shores?
Sure. The COVID unit here at Ontario Shores is a 10-bed unit that's on the different side of the hallway from all the other units, and it's a unit that was designed to house those that have tested positive for COVID-19 to prevent the spread to other patients and the other staff. So the minute there was a positive case identified, that patient was then moved off the unit into the COVID unit until the symptoms were resolved, and then they were brought back to their home unit thereafter.
And I believe you both volunteered to work on the COVID unit. So like some of us living in this world for the last year be like, why would you volunteer for a COVID unit? Why, when the call came, did you guys, we'll start with you, Desiree, like why did you decide that you wanted to volunteer?
Yeah, I decided to volunteer. I volunteered right at the beginning of the pandemic, the first time they asked for volunteers, and to me it felt like it was important for people to volunteer and that I was capable of doing it, and that, I wanted to role model that to the other staff as well. And, at that point we didn't know how big it was going to become, but it was going to be something that affected our daily lives, and I just felt like the more people who kind of step up and take that role, the better we could do in like handling it and responding to it, and also becoming more informed and knowledgeable about it. So I just thought it was super important for, to kind of right away step up and be able to do that and show everyone that it's okay.
Shawn?
So I volunteered much like Desiree. I felt that it was my opportunity at that point to step up and to lead by example. We have been planning this unit and working out the kinks for near 10 months before we actually opened it. New to the management side of things, I felt it was also an opportunity for me to develop those skills in opening a unit and kind of getting a team together. But in addition to that, it was more putting myself out there, making myself available for in these very types of situations. As nurses, it's kind of ingrained in us to do that.
What were some of the, I'm assuming there were some, like personal sacrifices and challenges that came with being on that unit at that time?
I think personally it was probably just time with family. I mean, it kind of varied between the lockdown restrictions, because I was also on PGU at the beginning. So, Ontario Shores did a really great job in making sure that those who volunteered could be safe and have other accommodations in the form of like a hotel. But you also give up kind of that piece of your personal life where it's just all you're doing really is focusing on work. and you kind of don't really get that time with family or pets, other things. And coming in for overtime, there was like such a small pool of people, so really like being on standby almost and just coming in when work needed you, and found like really being invested in work and the patients and how they were doing. So for me, it wasn't maybe necessarily fully a sacrifice, but it was just a change.
Much as Desiree had said, the sacrifices were very much of a personal nature, giving up time with friends and family. I was staying in a hotel, so I wasn't going home to see them. But as I alluded to maybe once before, is that the protective factors that were put in place to make us feel safe and supported was very appreciated, despite the change in routine and all of that.
Whether it's this specific experience or just being in your professions in general during this unique time, is there one or two things that really stand out to you in terms of things that you've learned during the pandemic professionally? We'll start with you, Desiree.
Yeah, during the pandemic, something that's really I found stood out to me is how well people work together. Like the temporary COVID unit, all of the nurses generally were from different areas, maybe didn't even know each other prior to all of this, and it being something where everyone could just come together and be a team and provide care for the patients and get on the same page and work together. Like that to me was really nice to see, because you kind of get used to working with the same team so often and you don't really always branch out, and it was really nice to see that. Something else that stood out to me is how resilient the patients are. Just with all the changes to their life, they don't get to leave here, right? This is their life, and there's been a lot of changes, a lot of restrictions or limitations in what they can do and visits and all of that, and I think they've been really resilient through all of it.
There's been many things learned as a result of this. With good planning come good results. The staff have stepped up. Nurses are tough. We say this all the time. When there's a problem, we rise to the occasion. There's been lots learned. Patients are resilient. The staff work together. It's just been it was an overall very good experience.
Is there one or two things that give you greatest sense of pride working, like you have, not just with the unit, but throughout the pandemic? Is there something that you would point to, like I'm most proud of, whether it's organizationally or in your unit? Is there anything that comes to mind?
To be honest, what puts a smile on my face and what makes me happy is getting the thank yous from the patients. To be honest, if I'm being sincere, we do as much as we can. As Desiree said, this is their home. They're locked down. They can't go anywhere. And the little bit of extra that we're doing, and we're going that extra mile. That little bit of extra we're doing, that thank you you get from them, really does make it all worthwhile. So I know it's a lot of work on our behalf, but in the end, it's all worth it when you get that. Those sentiments sent your way.
That's right.
Yeah, I think that I'm really proud of the organization and the response that they've taken to the pandemic. I think that they've done the best that they could to keep all the staff safe, all the patients safe, and we've done a really fantastic job. And even when COVID is present, and if people were to contract it here, I find that it's everyone's still safe. Like they've done the best that they can to kind of maintain that isolation period when people come in and protect people who may have the virus. So I think I'm just proud of the organization as a whole.
Well, thank you both for everything you've done during the pandemic and in your experience with the COVID unit, and for sharing your experiences today. We appreciate it.